One of the ambitions is to make sure that the impact of our work extends not just within Australia but around the world. And we've had a number of examples of that. But to be honest, the focus we have on equity, that's an overarching focus for us, making sure that the kids who currently are missing out don't miss out. They also extend beyond our borders. We do a lot of work in countries around the world, in Africa, in the Pacific and in Asia, on diseases like malaria and rheumatic heart disease and skin infections, vaccination, including developing new vaccines. I'm Jonathan Carapetis. I'm the Executive Director of the Kids Research Institute Australia. I'm also a paediatrician and a researcher. I've been at the Kids since 2012. Prior to that, I had been a director of another research institute, the Menzies School of Health Research in Darwin, and even before that had trained in Melbourne and was a researcher at the Murdoch Children's Research Institute. So I've been here at the Kids since 2012, taking over from Professor Fiona Stanley, who of course was the founder of this institute and of course remains our patron.
We as adults have an obligation to protect our children from disease and disability.
It all started with a question. What could we do here in Perth, Western Australia, to improve the lives of children and families both here and around the world?
It was during the 1980s when I realised that we needed to expand my epidemiological research and to partner with basic science and clinical sciences, that we had the idea of setting up an institute at the Children's Hospital.
Here at the Kids Research Institute Australia, which we like to call the Kids, we've got so many impacts of our research. That's actually one of the things we're most proud of, that our research has translated into many, many things that improve the lives of kids and families here in Australia and indeed around the world. I guess I'll pick three to kind of highlight this over the period of the Institute. One of the first that we're very well known for was some work done by our founder, Professor Fiona Stanley, and also Professor Carol Bauer, who back in the 1990s found that women who had babies with neural tube defects, such as spina bifida, had low levels of folic acid in their blood. And then they really explored this further and found that by supplementing folic acid or folate levels during pregnancy, women could reduce that risk of neural tube defects. Ultimately, that then translated into some work that led to fortification of bread flour in this country, which has had massive impact. Indeed, neural tube defects in this country are now much less common than they used to be, including in the First Nations populations. So that's a really exciting impact that we've had. More recently, we've really done a lot of work in the field of autism in children. And indeed, I would say we've got the world's leading program of research into this condition. We have developed the national guidelines for how to diagnose autism, including getting rid of the term high-functioning autism, which really was not appropriate for these kids. And then more recently, looking at the ways that children, in fact babies, in that first year of life could be identified as developing differently to other children, and then how the families could work with the communication skills of those kids in a way that would ultimately reduce the disability that they might have in later life. And this is now a major program that is being rolled out in Western Australia and in South Australia that will have a dramatic impact on kids who as I say, are developing differently, to reduce the severity of any disability they might get later in life. And then probably the third area I want to highlight is the Institute's deep and long-lasting commitment to First Nations child health. We have always had that focus, and indeed at the Kids we say Aboriginal health is everybody's business. And we do this in a number of ways. We've worked in a range of different disease areas, such as looking at rheumatic heart disease. We developed the national guidelines that are now being implemented for how to reduce the impact of that disease, the guidelines on reducing skin infections, some major work on ear infections in Aboriginal kids and families. We've also worked in the Pilbara on an initiative to really strengthen the local communities, organisations' ability to provide care and support to children and families in those places. But one of the things I'm most proud of is that we have also led the way in how research organisations should be working together with Aboriginal families in doing this research. And we've developed the standards, the national standards. We like to think they should be the national standards for conducting Aboriginal health research. And this, I think, sets the recipe for how researchers, communities, elders should be working together to make sure that community and family are part of the research process right from the beginning through to the end. So those are just three of what we like to think is a long highlight reel of the kids. Here at the Kids, culture is everything. We have a major focus on how to make sure this is and remains a great place to work. And indeed, we have put ourselves under the microscope, had an external review, made sure we're really addressing culture as the number one thing. And everything from how do we make sure that we support each other well and provide the right sort of behavioural environment, to providing also that support to the students and the early career researchers. We're very proud of what we do to support students. We've got more than 200 higher degree research students here. We have a fantastic way that we support them to support themselves. Our early career researchers, we really identify how to support their career pathways, providing seed funding, providing mentorship programs. And in the other aspect to working here is that we provide what I think are the best professional support services of any research organisation in the country. So everything from our grants office to our fundraising team to our laboratory platforms. This is a great place to do research. It's a place that people buy into because of the vision of the organisation, because of the overarching strategy of the organisation, that this is a place they know they can come, do their research, their careers can thrive, but also in so doing, they have amazing impact on the lives of kids and families. So really, I think the Kids is probably the best place in the country to be a researcher.
And of course, our world-leading researchers, who are asking the hardest questions about the biggest problems facing kids so they can live their lives to the fullest. We can't wait to see what we can achieve together in our next 35 years.
The thing that I reflect on over 35 years is how we've not only grown, but grown our ability to have bigger impact over that time. And that's positioned us beautifully for the future. We have a new strategy. It's called Research Reimagined, which is all about having much bigger impact on a number of focused areas. And that's really, I think, the future of research. So that's something that we're very keen for people to know about. And one of the ambitions is to make sure that the impact of our work extends not just within Australia, but around the world. And we've had a number of examples of that. But to be honest, the focus we have on equity, that's an overarching focus for us, making sure that the kids who currently are missing out don't miss out. They also extend beyond our borders. We do a lot of work in countries around the world, in Africa, in the Pacific and in Asia, on diseases like malaria and rheumatic heart disease and skin infections, vaccination, including developing new vaccines. So the impact of the Kids already stretches around the world, and certainly in our new strategy over the next 10 years at least, we're going to see that impact amplified even more.